A pulse oximeter is a photoelectric device that measures the level of oxygen circulating in a patient's blood vessels. It consists of a portable monitor and a sensing probe. An oximeter sensor is most commonly clipped onto a fingertip, toe, earlobe, or in the case of an infant, the distal foot. Once activated, the device sends different colors of light into the tissue and measures the amount of light that returns. It records the results as the oxygen saturation percentage, or SpO2. The measurement that is reported is the percentage of oxygen bound to the hemoglobin. Normally, the SpO2 is around 94 to 99%. Saturations below 94% may represent varying levels of hypoxia. However, some patients may present normally with an SpO2 of less than 94%, such as a COPD patient. Instead of relying solely on the pulse oximeter, incorporate it into your overall clinical assessment of respiratory rate and effort, skin signs, and lung sounds. Do not delay your initial assessment or the administration of oxygen in order to apply the pulse oximeter. A pulse oximeter is most useful in two situations: evaluating the effectiveness of any interventions you may perform, such as artificial respirations, oxygen therapy, or bronchodilator therapy, and alerting you to a deterioration of your patient's oxygen saturation. Now let's take a look at the steps involved in pulse oximetry measurement. Take BSI precautions. Select the appropriately sized sensor. Connect the sensor lead to the monitor and clip the sensor probe to the patient's fingertip. Turn on the pulse oximeter. Observe for the SpO2 and heart rate. Make sure the heart rate displayed on the monitor screen is the same as the patient's pulse rate, which you palpated already. Some pulse oximeters may display a pulsatile waveform, which should correspond with the patient's pulse rate. Once you get an accurate reading, check the oximeter reading periodically. A convenient time to do this is when you check your patient's vital signs. Frequently monitor the position of the sensor probe. If you think the sensor probe may become easily dislodged, consider securing it in place with tape. If you are unable to obtain a reading, or if you get poor waveforms or a trouble indicator, consider repositioning the sensor probe or moving it to an alternate site. In patients with poor peripheral perfusion, the earlobe may be a preferable site for monitoring SpO2. Fingernail polish will interfere with pulse oximeter measurement due to color differences. Acetone wipes should be stored with the pulse oximeter and used before attaching the sensor probe. When using a pulse oximeter, keep in mind that readings will not be accurate in all patients. For example, patients exposed to carbon monoxide, including chronic cigarette smokers, may have falsely high readings because carbon monoxide binds to hemoglobin. Anemic patients and patients who have ingested certain kinds of poisons may also have false SpO2 readings. Hypoperfused patients, including patients in shock or hypothermic patients, do not have enough blood flowing through their capillaries for accurate readings.